Stop ignoring your feet because they might be trying to warn you about something far more serious than you think. What if the dryness, the tingling, the strange color changes, or even a tiny cut that refuses to heal is not just a minor issue, but an early signal of diabetes slowly developing in your body? Many people discover diabetes only after it has already caused damage, but your feet often start showing signs much earlier. The problem is most people overlook these signals until it becomes painful, dangerous, or even irreversible. Right now, your body may already be sending you quiet warnings, and your feet could be the first place they appear. If you understand these signs early, you can take action before it turns into something life-changing. Imagine someone going about their daily routine, walking, working, living normally, but occasionally noticing a slight tingling sensation in their feet. It feels harmless, almost like the foot fell asleep. Days pass, then weeks, and the sensation becomes more frequent. Still, it is easy to dismiss. Life is busy, and small discomforts are easy to ignore. But beneath that mild tingling, nerves may already be under stress from rising blood sugar levels. One of the earliest warning signs that often goes unnoticed is persistent numbness or tingling in the feet. It may feel like pins and needles or a slight buzzing sensation under the skin. This happens because elevated blood sugar can damage nerves over time, a condition often referred to as neuropathy. At first, it may come and go, but gradually it can become constant. The danger is not just the discomfort, but the loss of sensation. When you cannot properly feel your feet, even small injuries can go unnoticed and worsen. Now picture another situation. A person notices that their feet are unusually dry. No matter how much lotion they apply, the skin keeps cracking, especially around the heels. At first, it seems like a weather issue or dehydration. But when dryness becomes severe and persistent, it can be linked to reduced circulation and nerve damage caused by diabetes. The body struggles to maintain proper moisture balance, and the skin loses its natural ability to stay healthy. These cracks may not just be cosmetic. They can become entry points for infections, especially when healing is slow. There is also the issue of wounds that refuse to heal. A small cut from stepping on something sharp, or even a blister from tight shoes might normally heal within days. But in some cases it lingers. Days turn into weeks, and the wound remains open or becomes worse. This is one of the most serious warning signs. Poor blood circulation caused by diabetes means less oxygen and nutrients are reaching the affected area. As a result, the body cannot repair itself efficiently. What seems like a minor injury can turn into a serious infection if ignored. Think about the color of your feet as well. Healthy feet usually have a consistent tone, but when circulation is compromised, you may notice patches of red, blue, or even pale skin. These changes may appear subtle at first. Perhaps the toes look slightly darker, or the sole looks unusually pale. These color variations are not random. They can indicate that blood flow is not normal, which is a key issue in diabetes. Over time, poor circulation can lead to more severe complications if left unchecked. Another sign that often surprises people is a burning sensation in the feet. It may feel like the soles are hot, even when they are not. This burning can be uncomfortable, especially at night, making it hard to sleep. It is another form of nerve involvement. While some people describe numbness, others feel the opposite, an intense sensitivity or burning pain. Both are signals that something is not right beneath the surface. There are also changes in the shape of the feet that may develop gradually. For example, arches may weaken, or toes may start to curl in unusual ways. This can happen due to muscle imbalances caused by nerve damage. It is not something that happens overnight. It develops slowly, making it easy to overlook until it becomes noticeable. By then, the underlying condition may already be advanced. Now consider swelling in the feet and ankles. After a long day of standing, some swelling can be normal. But persistent or unusual swelling, especially without a clear reason, can be linked to circulation problems or fluid retention associated with diabetes. When the body struggles to regulate blood sugar, it can also affect how fluids are managed, leading to noticeable swelling. There is also the presence of unusual infections, particularly fungal infections like athlete's foot or infections around the nails. While these can happen to anyone, frequent or stubborn infections may point to an underlying issue with the immune system. High blood sugar can weaken the body's ability to fight off infections, making even minor issues more frequent and harder to treat. Another subtle but important sign is loss of hair on the toes or feet. It may seem unrelated, but hair growth depends on good circulation. When blood flow is reduced, hair follicles may not receive enough nutrients, leading to hair loss in those areas. It is a quiet sign, often overlooked, but it can be a clue that circulation is not as healthy as it should be. Finally, there is the issue of pain while walking. It may feel like cramping or fatigue in the feet or legs after a short distance. This is not just normal tiredness. It can be a sign that muscles are not receiving enough blood supply during activity. Over time, this can limit mobility and affect daily life significantly. Now imagine putting all these signs together. A person notices tingling, dryness, a slow healing cut, and occasional burning sensations. Individually, each symptom seems minor. Together, they tell a story. A story of the body struggling to manage blood sugar levels, affecting nerves, circulation, and overall health. What makes this situation more concerning is how quietly it develops. Diabetes does not always announce itself loudly in the beginning. It often progresses silently, with subtle hints that are easy to dismiss. By the time more obvious symptoms appear, significant damage may already have occurred. This is why paying attention to your feet is not just about comfort or hygiene. It is about awareness. Your feet carry you every day, but they also reflect what is happening inside your body. They can reveal changes that you might not notice elsewhere. Think of someone who finally decides to get checked after months of ignoring these signs. They visit a doctor, undergo tests, and discover elevated blood sugar levels. At that moment, everything starts to make sense. The tingling, the dryness, the slow healing wounds, all of it was connected. And while it may feel overwhelming, early detection can make a significant difference. The body has an incredible ability to adapt and heal when given the right support. Managing blood sugar levels, improving diet, staying active, and following proper medical guidance can slow down or even prevent further complications. But it all begins with recognizing the signs and taking them seriously. Your feet are not just a part of your body that helps you move. They are messengers. They can reveal what is happening beneath the surface, long before more serious symptoms appear. Ignoring them can lead to consequences that affect not just your feet, but your overall health and quality of life. And as you start to pay closer attention, you may begin to notice things you overlooked before. The texture of your skin, the sensation when you walk, the way your feet look at the end of the day. These small observations can become powerful tools in understanding your health. Because sometimes the difference between early action and late diagnosis is simply awareness. And awareness often begins with something as simple as looking down at your feet and realizing they might be trying to tell you something important. And once that realization begins to settle in, something shifts. You start to pay attention in a way you never did before. Maybe one evening, after a long day, you sit down and actually look at your feet under proper light. Not a quick glance, but a careful inspection. You notice details that were always there but never truly seen. A faint discoloration near the toes, a small crack along the heel, a toenail that looks slightly thicker than the others. None of it seems alarming on its own, but together, it begins to form a pattern. Now imagine this becoming a daily habit, checking your feet the way you might check your phone. It sounds unusual at first, but it is one of the simplest and most powerful habits you can develop. Because the earlier you notice something, the easier it is to respond before it turns into something serious. There is a particular kind of silence that comes with gradual health changes. It is not dramatic. It does not force you to stop everything. Instead, it blends into your routine. You adapt without realizing it. You walk a little differently to avoid discomfort. You ignore that slight burning feeling because it goes away after a while. You choose softer shoes without questioning why your feet suddenly need more comfort than before. These adjustments feel normal, but they are often the body's way of compensating for something deeper. One of the most overlooked changes is temperature sensitivity. Some people begin to notice that their feet feel unusually cold, even in warm environments. Others experience the opposite, a persistent warmth that feels unnatural. This is not just about external temperature. It reflects how well blood is circulating and how nerves are functioning. When circulation is compromised, the body struggles to maintain a stable temperature in the extremities. This can lead to discomfort and, more importantly, signal an underlying imbalance. Then there is the issue of balance. It may not be obvious at first, but subtle nerve damage can affect how you sense the ground beneath your feet. You may find yourself slightly unsteady, especially in low light or when walking on uneven surfaces. It is not dizziness, but rather a reduced ability to feel and respond to your environment. Over time, this can increase the risk of falls, especially in older individuals. What seems like a minor issue can gradually impact mobility and confidence. Let's consider another scenario. Someone notices a small blister after wearing a new pair of shoes. Normally, it would heal quickly, but this time it lingers. It becomes tender, then slightly swollen. Days pass, and instead of improving, it starts to look worse. This is where things can become dangerous. In a body struggling with high blood sugar, even a minor wound can escalate. Bacteria can enter through broken skin, and with a weakened immune response, infections can spread more easily. This is why foot care becomes critically important, not as an afterthought but as a priority. Keeping the feet clean and dry, trimming nails carefully, wearing properly fitted shoes, and avoiding walking barefoot in risky environments are not just recommendations. They are protective measures, because once complications begin, they can be difficult to reverse. There is also a psychological aspect to all of this. Many people avoid acknowledging these signs because of fear. Fear of diagnosis, fear of lifestyle changes, fear of what it might mean for the future. So they delay. They tell themselves it is nothing serious. They wait for symptoms to become undeniable. But by then, the opportunity for early intervention may have passed. Now imagine a different approach. Instead of waiting, someone chooses to act at the first sign of something unusual. They schedule a checkup. They get their blood sugar levels tested. They ask questions. They become proactive rather than reactive. This shift in mindset can make all the difference. Because diabetes, when caught early, can often be managed effectively, reducing the risk of severe complications. It is also important to understand that these foot-related signs do not appear in isolation. They are part of a larger picture. The body operates as a system, and when one part is affected, others often follow. Fatigue, increased thirst, frequent urination, and blurred vision are some of the more commonly known symptoms of diabetes. But by the time these appear, the condition may already be progressing. Your feet, however, can act as an early warning system. They are far from the central organs, which makes them more vulnerable to changes in circulation and nerve function. This is why they often show signs earlier than other parts of the body. Paying attention to them is like listening to the first whispers before the noise becomes too loud to ignore. There is also the role of lifestyle in all of this. Diet, physical activity, hydration, and stress management all influence blood sugar levels. Small changes can have a significant impact over time. Reducing sugar intake, choosing whole foods, staying active even with simple daily walks, and maintaining a healthy weight can support better overall health. These are not quick fixes, but long-term strategies that help the body function more efficiently. Consider someone who begins to make these changes after noticing early signs. They start with small steps. Drinking more water, reducing processed foods, taking short walks after meals. Gradually, these habits become part of their routine. Over time, they notice improvements. Energy levels increase. The tingling sensation becomes less frequent. Skin condition improves. These changes reinforce the importance of taking action early. But not everyone recognizes these signs in time. Some people only become aware when the situation becomes severe. Ulcers, deep infections, and in extreme cases, the risk of amputation can become real concerns. These are not meant to create fear, but to highlight the importance of awareness and prevention. Because many of these outcomes are avoidable with early detection and proper care. It is also worth noting that genetics can play a role. Some individuals may be more predisposed to developing diabetes due to family history. In such cases, being vigilant becomes even more important. Regular checkups, monitoring blood sugar levels, and maintaining a healthy lifestyle can help reduce the risk or delay the onset of the condition. Now think about how easily these signs can be missed in daily life. Busy schedules, constant distractions, and the tendency to prioritize everything else over personal health all contribute to delayed recognition. It is easy to ignore a minor discomfort when there are more immediate concerns demanding attention. But health does not wait. It continues to evolve, whether we pay attention or not. This is why building awareness is not just about knowledge, but about habit. Taking a few minutes each day to check your feet, noticing any changes, and responding promptly can become a powerful routine. It does not require special equipment or extensive training, just attention and consistency. And as you continue to observe, you may begin to understand your body better. You learn what is normal for you and what is not. This self-awareness becomes a valuable tool because no one else lives in your body. No one else experiences what you feel on a daily basis. Recognizing subtle changes can give you an advantage in maintaining your health. There is also the importance of seeking professional advice when needed. Self-observation is valuable, but it should not replace medical evaluation. If you notice persistent symptoms, it is important to consult a healthcare professional. Early testing and diagnosis can provide clarity and guide appropriate treatment. Imagine the relief of understanding what is happening and having a plan to address it. Instead of uncertainty and worry, there is direction. There are steps to follow. There is a sense of control, and that can make a significant difference in how you approach your health journey. Your feet, often taken for granted, can become one of your greatest allies in this process. They provide information that is easy to access and observe. They reflect changes that might otherwise go unnoticed. By paying attention to them, you are not just caring for your feet, but for your entire body. And as this awareness grows, it can extend to other aspects of your health. You become more mindful of what you eat, how you move, how you rest. You start to see the connections between different parts of your lifestyle and how they affect your well-being. This holistic approach can lead to better outcomes and a higher quality of life. Because in the end, it is not just about avoiding a diagnosis. It is about maintaining function, independence, and comfort. It is about being able to move freely, without pain or limitation. It is about preserving the small daily activities that contribute to a fulfilling life. And all of this can begin with something as simple as paying attention to your feet, noticing the signs they are showing, and choosing to act before those signs turn into something more serious. And as all of this comes together, the message becomes clear in a way that is hard to ignore. Your feet are not just something you walk on every day, they are one of the earliest warning systems your body has. The dryness, the tingling, the slow healing, the subtle changes in color or sensation, none of these are random. They are signals, quiet but important, asking you to pay attention before something deeper takes hold. The difference between prevention and complication often comes down to how early you choose to respond. A simple check, a small decision to take symptoms seriously, or a timely medical visit can change the entire course of your health. What you choose to do after noticing these signs matters more than the signs themselves. So do not wait for pain to force you into action. Do not ignore what your body is already trying to tell you. Start noticing, start caring, and most importantly, start acting while you still have the chance to stay ahead of it.